Hi, my name is David Olds from the University of Colorado, Department of Pediatrics. The Nurse Family Partnership Program began really in 1977 in Elmira, New York, when my colleagues and I developed and tested the very first version of this program. And since then, we've repeated the original research in which the program is based in 3 separate communities in Memphis, Tennessee, and Denver, Colorado. And then in 1996, the Nurse Family Partnership, we were invited by the U.S. Justice Department to set up the program in communities around the country. And since that initial initiative, the program is currently in 380 counties in the U.S., serving over 22,000 families a year. Well, my understanding is that there are other communities that are interested in developing the Nurse Family Partnership in Florida. And we think that the success of these kinds of efforts really depends upon there being a strong community commitment and capacity to develop the program well. And so the fact that communities are interested in developing it is really important. Our experience has been that when there is a collaboration from funders and policymakers that cut across sectors, that the program's full range of impacts are appreciated more completely at the community level. And it's associated with this better community support for the program. And I think that nurses, most of all, in delivering this program, need to, their hard work needs to be valued, needs to be appreciated. It doesn't hurt to have a diversified funding portfolio for the program, but just as important, I think, is knowing on the part of the nurses that this is something that's really valued across the entire community. Well, I would say to those people who are concerned about public investment in these kinds of services that it's important to look at what the evidence really says. And if you look at the scientifically controlled trials of the Nurse Family Partnership, it has produced consistent and enduring and replicated impacts on outcomes of maternal and child health, long-term involvement of young children in the criminal justice system. And these are considered to be the very best types of scientific studies available. And if you, the Washington State Institute, as their Institute for Public Policy, has recently evaluated the Nurse Family Partnership from the standpoint of its return on investment, and has estimated that on a per family basis that government and society receive about a $20,000 per family return on that investment. So I think these are really hard economic times. These are really hard fiscal times for state and local federal governments. But that means that we really need, in my view, to look at how scarce public resources are spent and where they may produce the greatest leverage and return for our communities. And I think that this is a good one. Well, I think that the Nurse Family Partnership has shown consistent effects on improving women's prenatal health, especially their use of tobacco and during pregnancy. Tobacco use during pregnancy increases the risk for prematurity and low birth weight, and increases the risk that the child is going to die. And there's also evidence that it has long-term impacts on the child's neurologic development. So reductions in tobacco use during pregnancy, very important. Reductions in complications of pregnancy, like pregnancy-induced hypertension, very important. Reductions in injuries to children. We see injuries are the leading cause of death among children aged 1 through young adulthood. We see that families who have the nurse are less likely to have closely spaced subsequent pregnancies. That's important because it means that women will be able to start to achieve the kind of economic self-sufficiency they want. But we also know that when babies are born spaced closely together, that they are at greater risk, again, for prematurity, low birth weight, infant mortality. And there's a recent study that was published about 9 months ago that suggested that the risk for autism increases when pregnancies are spaced closely together. So the potential benefits of that are really important. We see increases in mothers' participation in the workforce and reductions in public involvement with public assistance. And these have direct bearings on tax revenues and cash outlays for government. Very important. So, and we see consistent, enduring effects on children's language development, math, and reading achievement for children who are born to mothers who are more vulnerable and living in really disadvantaged communities. So all of this, and it's exactly these kinds of functional outcomes that the Washington State Institute for Public Policy has based its estimates of return, economic return to society. Well, I think that the key here is whether families choose to be involved. The question is, let me start back. The question has to do, are these kinds of services intrusive? I think that there is a challenge, I suppose, that we need to address in terms of government intrusion. I think that's a legitimate concern. The question would be, do families choose to participate, and to what degree do they participate, and what kinds of value do they attribute to this program by their showing up? And if they don't want it, they don't have to show up. But I think that the high rates of participation, engagement, the kind of event that we're involved in today, where families are showing up and being so proud of what their young children have accomplished, and they've accomplished so far, as a tribute to the value that families receive from this kind of service. So I think that's the question. I think that those concerns about government intrusion are legitimate. The key is that families are choosing it and they're staying with it. That matters. Well, I guess what I'd like to say is that we were thrilled when the president started talking about the Nurse-Family Partnership and its benefits to society and so forth. What is sometimes overlooked is that we had, this is a program that had deep bipartisan support. In Pennsylvania, the program was promoted by Governor Ridge. In Colorado, the program was promoted by Governor Owens. So we've seen members of Congress at both the Senate and in the House from both sides of the aisle support the program. And so I think for people who are really concerned about how to spend scarce public dollars more effectively, they have looked to the Nurse-Family Partnership as a model for very strong evidence-based policymaking, and we're honored and we're optimistic. I think that in the long run, these kinds of investments will. The Nurse-Family Partnership is a good example, but it's not the only example. There are other evidence-based interventions that we should be using as models for deciding how, again, scarce dollars are going to be spent. What I would love to say is that you folks in Palm Beach County have it right. It's the kind of thoughtful commitment to choosing programs that have strong evidentiary foundations, that make sense to families, that you've got people from across the health and human service spectrum community weighing in on how scarce resources are going to be spent is exemplary. And it means that when those services are funded, it means that they have the backing of the entire community. And it's that, I think that's a model for the way we ought to be doing this work across the country.